Join Disruptive Doctors. Oh, Disruptive Doctors. Impact and improvement.
Welcome to Postcall, Beyond the White Coat, the podcast where we explore stories beyond the white coat and how doctors are impacting healthcare differently. I'm Dr. Selina, your host and co-founder of Disruptive Doctors. At Disruptive Doctors, we're building a platform to help doctors like you impact healthcare differently. So join the movement and sign up on our platform to connect with a community of forward-thinking doctors who are impacting healthcare differently. In this Postcall, we'll dive into stories of doctors who are breaking the mold and redefining what it means to be a doctor. Today, I'm excited to introduce a very special guest, Dr. Chia who is not only a dedicated clinician, but also a dear colleague I met back in 2016 when we were both in Anesthesia and ICU department in Hospital Sungai Buloh. Now, at that time, I was aspiring to become an intensivist until a slip disc changed my career path. But Dr. Cheah, however, continued his journey in anesthesia, moving from KKM to working in the NHS in the UK. We'll explore what inspired him to choose anesthesiology and the challenges he's faced. See, at some point, I think many of us wondered if there's more. For Dr. Chia, we want to find out what's the moment that led him to pack his bags and head for the UK. Was there a breaking point, or was he just chasing a new dream? Will he be returning to Malaysia one day? What advice he has for young doctors and those who dream of moving to the UK to practice? This is Postcall Beyond the White Coat. Hi, Dr. Chia. Welcome.
Hi. My name's Ken Seng. Usually people call me Ken Seng or Dr. Chia in the workplace. So I've been in anesthesia since, I think, 2013 until now. So I was trained mainly in KKM, and then after that, I moved to the island for a job. And right now, I'm in Cambridge University Hospital working as an anesthetist and clinical fellow in Cambridge, UK.
So what initially drew you to becoming a doctor in the first place?
Have you ever heard of, a lot of times people were saying like, oh, you were inspired by the TV drama series and all that. So I'm the typical one of the one that got influenced and got attracted by it. So I remember when I was a young kid, there was an ER series showing in TV2 and all that. So I think from that time I started to aspire to become like a doctor. And also at the same time, I don't think I'm very good in other subjects apart from science. And I think helping people is rewarding for myself. And because of that, eventually I got into medicine after my college year when I was 17 years old. Yeah.
Okay, but why choose anesthesia? I mean, for me, I joined anesthesia ICU mostly for the ICU part, because I had a chance to work with one of the best intensivists like you. I don't know if you think she's one of the best.
Yeah.
Shanti. I learned so much from her, and I saw what the art of medicine was, and really understanding the human body, how it functioned, and how she brought patients back from the dead. It was so fascinating. So what was it for you that made you choose NS?
So for me, I think like everyone else during the housemanship, you on and off, you think of what you're gonna do in the long term. And I have a few variations, and my mind changed from time to time, from posting to posting. So I've been thinking about surgeons to be general surgery, cardiothoracic surgeons, and even pediatricians, and I'd be an internal medicine physician. But when I into anesthesia, I finally found a balance where I get to do a lot of procedures at the same time and doing something like internal medicine, which is like a critical care. Because I think anesthesia gives me a balance between those two. So and then eventually when I got into the department, I start to train as a junior trainee. Slowly it become more and more rewarding as you learn your skills and all that. So I got started from there, where I can see there's a balance between the clinical skills and the knowledge and the physiology and critical ill patients that makes me feel satisfied and rewarding.
Okay, so you started working in KKM around 2011. I guess that's about the same time. Yeah, that's about the same time I also started working in KKM. But While I was working there, the time it was enjoyable sometimes because I had great colleagues and I had this mindset I wanted to learn as much as I could. But slowly being there, I felt very stagnant. I started to feel like I wasn't growing and I was constantly exhausted and overworked. Half the time I'm not in my own bed, I'm sleeping in the hospital. And there are times I wondered if there was more. So, what was the experience like for you in KKM?
Oh wow. Like I think same experience with everyone. I think the initial training time was very tough. It was just tough, and mainly because you were still learning, and then you try to get the work done, but your workload is so much, and we often get scolding if you still remember back. I mean, I'm not sure whether is it now still the same, but back in those days, we used to get a lot of scolding when we would just join as a junior, and after that you slowly pick things up and then become more and more better, and then the scolding get lesser and less but never disappeared. I think the tough part is the work-life balance for me. Like you remember, like in a month time we used to have to work 2 weekend, which means that your weekend is just gone, and then you have two more weekend left, and sometimes you have to work like long day on Friday, and then that makes only Saturday and Sunday. So work-life balance was very limited, affected, and the long working hour as well, 24 hours from 8 a.m. to 8 a.m. It was initially when I was still young, you're in 20s, early 20s, no, sorry, mid 20s, you're still able to do that, and then you're still able to live a normal life after your 24-hour shift. Eventually, I think if you approach 30s, you get more and more exhausted, and basically the post-call day, you just spend like at home resting, and the next day you are back in work again. So I think this like a snowball, you slowly accumulate, and then eventually you get fatigued and you get exhausted, and then you start to doubt yourself, how long am I going to do this, and how are you going to survive this for this long period of time for whole life? Yeah.
So, how did you motivate yourself to quit, not resign, and keep going?
Well, actually, this has went through my mind many, many times. I can't even remember how many times before the exam, stressful time. I often ask myself, like, is the right path for me? Whether do I want to continue doing that? But I think what I learned from a lot of people is don't make decisions when you are at the most stressful time. You let it pass, and then have a proper thought and discussion, and for proper chat with people, especially more senior people or your supervisor and things like that. So eventually for me, why I still doing the same clinical jobs and still doing persisting despite of that is because on a good day, I find it rewarding, and then I was like recharged, and I feel that, okay, I can do this again, I can keep on going. And in long term, I really realized that clinical work is really something that I enjoy. I might have a bad day, but let's just pass it and then focus on the good day and try to get a balance during a heavy work day. So on and off, I had like some hiccups, some obstacles and all that, but just try to stay focused on your long-term goal, and then that is where am I today. Yeah.
Do you think that came with and wisdom to know that
Yes.
there are good days and bad days?
Definitely, definitely. I think growing up changed your mind as well. Like last time for me, it's just work and work, and I'm not thinking so much on family. But I think as I grow older, especially now I have a wife and 4 months old, I feel like I want to spend more time with the family because I mean work is work, but sometimes the precious time with the family, if it's lost, it's lost. So you need to find balance. Really, really need to find a balance for it so that you won't exhaust yourself too much, but at the same time you can move on with your career and you get to spend time with the family.
So, what was rewarding for you while you were working in KKM?
Like you said earlier days, although it's tough, high workload, but we do have like a very good colleague. We used to stay back after work, even though we are not on call, just to help our colleagues. I'm not saying that everyone is fantastic, but we do have like a good team of people. So that makes you feel satisfied, like knowing that you have someone working as hard as you, and then we try to get the job done. And at the end of the day, you go back late, but then you feel satisfied and you have a good bonding with your colleague back in those days in Sungai Buloh as well. Other rewarding things in KKM, I would say the clinical exposure is really, really good, especially now I'm in overseas. I'm really grateful that I was trained in KKM because you get to do so many things during your junior time, like, and especially on call where everything could be chaotic, where you do CPR or two CPR in the night, and then you do lots of procedures in ICU. You see a lot of cases. I think that is the very precious part of the training, and it's rewarding. Might not rewarding during that time, but it is definitely rewarding for me now because it gives me like a very good foundation and a good exposure before I work in other countries.
Okay, so again, we both served in KKM for about 10 years. 2021, I resigned KKM to start Disruptive Doctors because I felt I wasn't creating any impact in whatever I was doing at that time, and I wanted to do something bigger. So in 2021, you also packed up and moved to the UK. Was there a breaking point that made you to make this decision, or were you pursuing some other goals?
Well, I think, yeah, 2021 was the time that I think all this while, I have been thinking of trying to get more exposure and get more training in other country or in overseas, whether like a subspecialty training in overseas or get a few years exposure in overseas. That has been in my mind all this while, but because of the ongoing KKM job and the exam and things like that, so I only get to put on hold, but by only just hoping that in the future I might get a chance to do that. The real breaking point I think was during the COVID time where we started having a MCO and we have a things are so chaotic and everyone is vulnerable to get the infections and all that. At that point, I would start to think like, okay, if I got COVID one day and then I just die, that is my life. That's it. So I was thinking like, these things happens, and if I get a chance, I would really want to go for it because you will never know what will happen tomorrow, especially when you see during the COVID time where everyone gets sick and then the patient that you're taking care will just pass away, succumb to the illness and all that. So at that point, I was thinking with myself like, if I don't do it now, I might not have another chance in the future. And also at that point, I just finished my exam, my para pathway exam, my fellowship of my anesthesia in Ireland. So basically, once I finished my exam, I was like at a crossroad where I have to continue training for 3 years before my exams, or I get to get a little bit of exposure in overseas. So that's it. I decided to go for it, try to get a job, try to apply, and fortunately I got a job in the end. And so I moved on from there after second wave of the COVID in Malaysia.
Did you apply to get into the master's program in Malaysia?
So I got it. I applied. I applied once. I think back in 2015. I applied in 2000. I can't remember the exact year, but I got it. I didn't get it on the first year, but the second year, there was a test called entrance exam, where you have to pass it before you go for the proper entrance exam before the masters. So I attended the first exam and then I got it through. And then towards the second exam, because at that time I was preparing for my second part of my para pathway paper, so I decided not to go for the master program in the end. Yeah.
Okay, earlier you mentioned about going through COVID and then losing patients. What was it like during that time for you?
Hard to imagine. You basically at that point, everything happening, too many things happen at the same time. You got to go to work, you got to make sure that you don't get infected, and you keep hearing news that the people surrounding you got infected, and at the same time you worry that whether your family, your elderly at home will get infected. So there's too many things ongoing at that time, and at the same time you just have to keep on going to work every day regardless of what happened, because you know that at that critical time you need to go to work and you need to perform, and you need to take up the responsibility because it is your job. So I think as this goes by for many months, it sort of like makes you black out and blank and just doing things like without any, not to say without any passion, but you just at the end of the day you tell yourself like, I just want to get through today and that's it. I have no plan for the future yet because I don't know what's going to happen tomorrow. I might get COVID next week and then I might get very ill next week. So there's no room for you to think of a lot of things. Basically just just work, go home, rest, hope that you don't get infected, and then the next day again and again. That happens for like almost a year, I would say.
Actually, that sounds very exhausting. I've heard of news where patient gets into the hospital and they just go missing because they end up in a body bag.
Yeah, it was tough. I would say it was tough, and it's not easy for us as well working as the front line. To be honest, I felt disappointed. I mean, not disappointed. I felt upset just because I lose a few patients. I mean, all of us, we as the day goes along, we build rapport with the patients, and we kind of like have a feeling towards the patients. After like a few months, you still lose them. So it wasn't a great feeling. I remember even the last day of my work in Sungai Buloh, I lose a patient, and that really makes me emotional at that time, because I remember that was beginning of the year during the Chinese New Year where everyone is celebrating and all that. And the patient that I lost is a Chinese family. So can you imagine, like during Chinese New Year, like after third or fourth day of Chinese New Year, you receive a phone call from me saying that your family member is very ill and then they pass away. So I will remember that forever, because that was that bad in terms of the feeling for myself.
How did you overcome it?
Well, I shed a few tears that time, I remember, and then talk to people. I would say talk to whether your family or your partners or close friend. And when you talk to people, you express it, and then you try to like let it out, and then at the same time they have their part of story to tell when they have that bad day. So you kind of like realize that this is not only you. It's like this happens to everyone across the country or across the world, where you lose people and at that critical time. So I would say it takes a few days for you to get better, but as long as you talk to people, you give yourself some time not to push too hard on yourself, you will get better in the end.
Sounds tough. I mean, I remember when I was still practicing, you don't really talk about the deaths that you have on your shift.
Yes. That's the thing. That also one of the major thing that I realized, there's a difference between from where I work now and back in KKM. So last time we used to like carry on our job, even though we pronounce the patient death, and then we carry on like a normal daily job. And what I realized here in overseas was that people will gather around, even though it's maybe just 5 to 10 minutes, just to have a chat. Everyone gets to talk. The nurses, the junior doctors, the consultant, the resuscitation team, just to reflect and just to give everyone a room to express whether they want their anger or they're disappointed or they think that they have done a good job. And I told one of my colleagues that back home, back in those days, where we would just carry on at night. I might lose two patients, but after that I would go to see a new case without any feeling. So one words that he told me that really makes me think twice is that he was saying that yes, you can do that. Even he can do that, but can you make sure you will be okay in 10 years time? Like if this happens accumulative in accumulations, so you might not notice the benefit of it at that point of time when we talk about it, but in long term it might, because that happens to me in COVID time, where we keep losing patients, and then since when we were just started training, we hardly talk about that. We just like, okay, the patient died, we try our best, that's it, we carry on. So I think that make it in a snowball as well. So right now the major change in my own practice here in the UK is I talk a lot to people, and I invite people to talk with me whenever they need to. So there's a lot of talking, even though with just expressions of feelings or opinion. That's fine. That is the beneficial in long term.
Wow, it's so different from KKM. Like from when I can remember our entire practice here, maybe the whole 10 years here, we do not express. I mean, we all have lost patients some point of our career. We are disappointed, angry. Sometimes you're sad because you're losing patients that you shouldn't be losing, and it seems senseless. But it just becomes another number or another death cert that you just sign off and forget about it.
Yeah. That I think that we could have. I mean, we got brought up in this way, so I think it's good to have a second thought about that and see what we can do just to avoid, exhaustions and psychological well-being as well for the doctors.
Yeah, because I've actually met a couple of doctors who resigned right after the COVID wave. I think same time, 2021. They got so sick and tired of losing patients day in, day out. They were basically holding up the phone so that the family can do a video conferencing before
Yeah.
they intubate the patient. Because once you intubate, chances
Yes,
are
yeah.
quite slim. That's it, right?
Yes, exactly. You never know what will happen, and that might be the last time that they manage to video call and have a chat about it. So yeah, it was very heartbreaking. I would say everyone would have felt that during the COVID time. It's not easy. Therefore, and then also because we hardly talk about that, like what you say. So I think that slowly accumulate to become like a negative impact on our wellness and lead into exhaustions and burnout as well.
Okay, how did you get into the NHS? I know you said you applied for the job. Like, how did you go about it?
Actually, I did not join in the first. I mean, in my first destination. Right after the COVID, I got my fellowship exam. I passed my fellowship exam. So initially I got a job in Ireland, in Dublin, because my paper was recognized by the College of Ireland's. So I went for a few interview, and then I got a job after a few interviews. And so I actually my first experience working overseas was in Dublin, Ireland, before I moved into NHS. I would say moving to Ireland was one of the best decisions that I have made in my career and in my life, because I met so many good people there, good bosses. So when I was in Dublin, Ireland, I have this adaptive period where I can't really blend into the system. So it takes me like a few months time to get along with the healthcare system, although they are still doing the anesthesia job and all that, but it's still different. So along the way, when I work, I got all with my bosses, my colleague, and they helped me a lot, and they told me that, I mean, we had a discussions about my career, and we found out, and then I realized that there was another job opening in NHS, which is Cambridge, at that point of time. And then I was like, wow, Cambridge! I never ever could imagine that I work in the Cambridge University Hospital, but I got a lot of encouragement and guidance from my consultant at that point of time. They give me a very good reference, and they helped me with the interview skills, and I applied the job after that, and I got into Cambridge after 1.5 years in Dublin.
What about the first time when from Malaysia to Ireland, how was that process of applying for the job and going for the interview?
So the interview was quite okay. Basically, they were just asking about your experience and how confident are you in doing procedures, resuscitations. And I think, if I'm not mistaken, our housemanship training is recognized by the Medical Council in Ireland. So you can take that into account. So we, coming from Malaysia, we have lots of exposure because we went through all the rotations, unlike in the in Irish and in the UK training program, where they only have selective modules or posting. For us, we went through all of it. So it was a good asset for us and a good training for us. They really loved that. And then basically they were just trying to assess you whether you are safe enough and you are competent enough, and with the proper qualification like exam papers and all that. And most of the time you'll be all right after got through the interview. And then I applied to get my IMC, which is like an MMC in Malaysia, in Ireland, to get the medical registrations. And once I got those two, they will help me to get a work permit to work in Ireland. And then that takes maybe a month to get it approved. And once you got these three items tick off, you are basically ready to go to work in overseas Ireland.
Fun fact, actually, I did apply to go to Ireland. I went for the interview and I never heard from them again. I guess you must have done very well.
Well, no, actually depends on how many people apply as well. I mean, it's always a competitive interview, even though in the UK as well. Like there are many people that apply, and it also depends on how many people apply at that time and how competent it is. Whether some other people have more qualification, then they will tend to take them in more likely. But yeah, I would just say keep trying until you will definitely get one if you persist. Yeah.
Okay, so like you mentioned, adapting to a new healthcare system can be tough. What was it like for you, the challenges for you?
So I think mainly because when I first got into, let's say about Dublin then, when I first got there, I was very quiet. I will realize that because I mean I think this is just part of how we brought up. You were new in the system, you don't know anyone, so you tend to be a little bit more quiet and try not to make mistake and try not to, just afraid that you're making mistake and afraid that people might see your mistake. So for me, the first few months it was very tough. I basically a bit more quiet and didn't really speak up to people.
Okay.
So I think that was my challenge, and also gaining trust from, I mean, the bosses are okay, the consultants, all the senior people, they are good. Generally, all of them are good, but sometimes I don't blame like some of the nurses, the ODP, or you call it anesthetic nurse in Malaysia. I mean, it makes sense because they don't know you, and then you are just like someone from Malaysia come out of nowhere, working in a theater, giving anesthesia to to a patient there. Because because I went through the interview, my bosses, they know that I have like a good experience in anesthesia and I passed my exam. So basically, they are happy for me to do my own cases sometimes. But on my first few months when I encounter with the nurses, with the surgeons, I wouldn't say that they come face to face telling me that I'm not sure this guy is it okay, but from the feeling that I got, they might feel a bit uncomfortable me doing the job. But that doesn't last for very long. I remember one of the nurses keep on asking me like, are you like when I asking for some equipments and some drugs, and they were like, are you sure, are you sure? They would keep asking like, are you sure you want this, are you sure you want this? So in my mind I was like, am I doing the wrong things, or is it because they just want to clarify? But I just carry on with my job. And then I remember at the end of the list, one of the nurses came to me and say, Kian, I need to apologize to you because you've done a great job, but because we don't know like your exposure, so we were just trying to be safe. But you definitely you are safe enough, you're competent, we are happy to work with you, and looking forward to work with you in the future. I was like I told them that, okay, I really appreciate you telling me that, because I myself, I'm also adjusting as well. And I think from that day onwards, basically I work very, very well with them. And I think with days, I slowly become more and more outspoken and more speak up, even though if I'm not sure of anything, be more confident than when I first started to work. So that eventually slowly get adapted into the systems and work well with the people. And right now, I would say I have a very good contact with them, and I still keep in touch with all the nurses in Ireland, in Dublin, because we have such a good relationship and have a good memory working there, although it's just 1.5 years.
Well, it sounds very different from here. I know here in KKM, you want to stay under the radar, don't do anything extraordinary, just keep your head low, stay out of trouble, and then you'll go through and get through safely.
Yep. That is not the best. That is not the strategy here working here, because I remember one of my senior supervisor told me that like don't be. I mean, it's good to stay low, but because you staying low, people don't know that whether you are just quiet or you actually don't know, or you have something hiding. So I would say the breakthrough part is to try to show yourself, not to say try to make yourself feel like a very great doctors or very capable, but at least to show professionalism, speak up, be confident in asking things, even though it's a simple questions, but you still can ask people about that. So the good thing about the working culture here is everyone can speak. Even like, say there's a professor in surgery, there's a professor in this surgical department, and this is a junior doctor in the theater. They can speak directly face to face without feeling afraid of getting scolded or anything like that. So this is the main difference that I noticed. So I think after a few months, I start to blend into them, and we all just speak up. There's no hard feelings and there's no anything that hidden inside. For the work and for the safety of the patient, you just talk like a not like a professional, like a doctor. Even starting from a junior doctor for them, they start to do that during their training, which is good.
Okay, so now that you have the opportunity to work in two different healthcare systems, what are the similarities and differences you notice?
I think KKM and NHS or Irish program, I think the training are equally tough, although it takes a bit longer for Ireland and UK trainee to get into consultant post. Takes around 6 to 7 years for them, and most of the time they will continue with the subspecialty right immediately after they finish their training. I think the main similarity is the tough training that you need to get rotate to different rotation, like to do pain, to do pediatric, and to do cardiothoracic and things like that. It's the same for them as well. They have to move different places every few months to get the logbook done. The initial period as the young trainee is the same as well. It was tough. I would say less coding for them, less thing from the consultant or from the bosses, but basically the pathway of the training is almost the same for both of them. Workload wise is almost the same as well. It's equally busy in NHS, and you can hear so many news in NHS that there's a long waiting list and all that. So this happens everywhere in Malaysia and in UK and in Ireland as well. High workload for the trainee, a long training period of long training time and tough training in the beginning.
What about cultural differences or similarities?
Cultural, I would say, they're equally, the patients equally friendly. They wouldn't be less. They really appreciate overseas doctor coming to work and helping them. So I don't, right until this point, I don't see there's any racisms or any negative remark from the patients. I even often get hugged by a lovely elderly lady for giving anesthesia, and they don't call me Dr. Chia anymore. They call me Love. After they woke up in the recovery, I was asking them like, how are you? And oh, I'm great, Love. Thank you so much, Love, and things like that. So I think the culture wise is still very friendly and very nice to work in. We still have a very good work colleague, and despite of the workload, we still try to cover each other and get the job done. So it's basically almost the same like in KKM in this aspect, I would say.
So what about work culture, the work environment with colleagues and your bosses and all? What do you think we should be learning from the environment there?
Yeah, I wouldn't say this is a similarity anymore. I think the work culture is a bit different in NHS, where there's more work-life balance here, definitely. I'm not sure about other hospital, but at least in my hospital, they really adhere to the 40 hours week job. It's a very serious. It's stated in the contract, and you need to fulfill that. So I only work 39 to 40 hours per week, where we work way longer back in those days, KKM. So work-life balance is good. I have a very good free, I have a night shift for these few days. I will get 2 days off before my night shift, and then I get 2 to 3 days off after my night shift. So before and after night shift, I get enough adequate rest. And we don't do 24 hours job anymore. The night shift, the so-called on-call, is actually a 12 hours job. So it's more work-life balance. And the culture here, there's more flexibility, I would say. I think a few years back, the NHS and the Irish council, the college, the Irish college, they roll out the so-called less than full-time job, which I think is good for some people, which means that if you can't work full-time, you can liaise with the college or discuss with the employer whether you can do 75% full-time job, which means maybe 3 days per week. So that gives a lot of people a lot of room, especially for those who have kids, who needs to take care of the kids, takes turn with the partner. They get a bit of flexibility to continue their job, but by not resigning entirely, which I think it gives some space and some flexibility to a lot of people for them to keep them in the workforce, but at the same time let them plan their life and fulfill their duty as a partner, husbands, or as a parents, which is good, I think. And like I said, we do speak up a lot. That is one of the things that is different from what we came from. We have a very good well-being is a very important thing here in the UK. Like everyone gets a supervisor where you need to every few months. I would say every 3 to 4 months they will email you or they will call you and just to make sure that you're okay. It's a mandatory thing. Whether you're okay or not, they will have a quick chat with you, asking you about how about yourself, how about your family, how about your job, and is there anything that they can help. So I constantly get these questions as I work. So I feel supported in this way, which is good. And the normal daily thing that we do, like say today I work with certain people in the theater. The things that we usually will do, say today is a Monday, so the common topic that we will have is, oh, how's your weekend? Where have you been? And then they will share like what they do the weekend or things like that. So this kind of like makes busy life, busy working place a slightly feel less busier, just because you have a bit of a ice breaking and a bit of a time off, talking about something more relaxing and some time off from the job.
I think that's so important. I mean, we've been in NS for a few years. I remember some OTs when you go in, it feels so cold and chilly. Nobody is supposed to speak because this surgeon is there and he doesn't want a single noise. And it was so funny. The moment he left, it felt so much warmer. Suddenly people were chatting and then it became livelier.
Yes, definitely. Well, we still have that in UK. Like, I mean, not all the time, but sometimes there's a few critical time during a case. I say during inductions, we would want like an entirely quiet environment. Even that time here from where I work, only the anesthetist and the assistants and maybe another assistant will be there with the patient. The rest of the theater will be quiet. The surgeon will wait outside. No music, no radio, nothing like that. And only after we finish the induction intubation and secure everything, then everybody comes in, have a chat. That's like just like a warm environment. And then sometimes during critical period where say the surgeons need to do something very very critical, they need like a silent. They will just let us know that, oh, we're gonna do this for next few minutes. Can everyone just stay quiet for some time? So everyone will just comply and we let them do the job. And then once it's finished, and then everyone start chatting again, and the environment become like relaxing and warm again. So it's not like the entire day where you have to be very quiet and very careful in doing things. There are certain time where that's why I think speaking up is important. Like we just tell people that I'm gonna do this very critical step. So we need like real attentions and all that. So it's good in this way in my workplace.
So I guess what I'm hearing is we need more communication, because here I realize it's not really communication. We just give a death stare, scream, call them stupid, all that just to convey our message across.
Yeah. It's the most important thing, and I would say to coming from a different country, from a different system, is also one of the difficult things to break through. But once you got it through, it became so much easier to work, and it became so much easier to deal with, to adapt into the systems. So it is one of the very important things that it might be their culture to start up from the start, like maybe during medical school, but from us it's a bit different. But it's not impossible to get into that. It just needs some time, and you just need some patience and a bit of encouragement from people.
Yeah, I think I remember most of what we are told is what was mostly focused on is communication with patient, build rapport with patient, but everyone overlooks communication with your peers, building rapport with your peers, communication with your superiors and your people who report to you. How do you build rapport with all these people? It's like completely not there.
Yeah. And you don't have any like a feedback. Another thing that I realized is very common here and is very useful is we have a lot of feedback. Like even right until now when I'm doing my job, I have a lot of feedback. We can have feedback from either from your superior or from your same level colleague, even from the patients or from the nurses as well. So we have like a proper like a paper and a form where you fill up the feedback. On and off, we send off feedback to your colleague and to nurses and even to patients. Sometimes when the patient wakes up in the recovery, I'll just give them like a paper for them to fill a feedback. So I think this is very important because that helps you to reflect on your the good thing that you have or the things that you might need improve. So 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 this is what I think we are lacking as well. So right now we have been doing a lot of feedback to like I have write feedbacks for my colleagues or even for my supervisor, like how he did as a supervisor, whether he's very approachable. So they are all very all rounded in this. And I mean, this is very important for our revalidation as well to continue working. But it is one of the good example that I find it very useful because through feedback, I know what things that I've done well that impact other people and what things that I might need to improve on, which is good.
Okay, so there are many young doctors now in KKM especially that are resigning either before they complete housemanship or before they get their APC. What's your advice for them?
I would say talk to people. Talk to people. Even I realize by talking to people is very important, and the person that you talk to might not give you the answer or guidance, but they might know someone that might help, and then they might connect you through that person. So I have been talking with a lot of people, getting to know a lot of people. Like when in Ireland, I get to new friends. Coming to UK, I get to new friends, all through connections. And from talking to people, you get guidance and you get the support. So right now, often I still get contact by one of my ex-colleagues to talk to those junior doctors who want to come share my experience and all that. So I think talk to people is very important, and if say you want to go abroad, which is okay. I wouldn't say that one healthcare system is better than another because NHS has own problem, KKM has own problem. There's no perfect healthcare system, but try to look everything all rounded and try to make evaluation yourself. And once you make up your mind, just go for it. And maybe the first few months or even the first year might be tough, but it definitely will be rewarding in long.
Okay, so do you see yourself coming back to Malaysia someday, or is UK now home?
No. We still pretty much miss Malaysia on and off. So I think I wouldn't rule out completely that I will not come back. I mean, ultimately, I will still want to come back to the lovely weather and enjoy my good food. But probably in the future, I will think about that as long as there's an opportunity. But I think for these few years, I will still continue like working here and get my sub-specialized training done and try to get a little bit more experience, try to learn something a bit more different before going back. At least I get something done and I can go back and help out with the healthcare, hopefully.
Any last words?
Any last word? I would say thanks for inviting me, and it's nice to talk to you again after so many years. It's always nice to have a quick recall back how far we've been through and all that. I would say if anyone has any aim or goal to try something in their career, just talk to people and evaluate. And once you make up your mind, go for it, and you receive support from people if you ask for it. Also, I think that's a very important step.
Okay, thank you, Dr. Chia. So if you guys have been enjoying our conversation and considering exploring new career paths, remember to check out Disruptive Doctors and also our non-clinical pathfinder workshop, where it's designed to help doctors like you discover and navigate opportunities beyond your traditional setting. Also, do check out our annual conference where doctors are impacting healthcare differently, and it happens every August, where like-minded doctors like you come together and share ideas and impact healthcare differently. Now that wraps up another episode of Postcall Beyond the White Coat. I hope you've enjoyed our conversation with Dr. Chia and gained some valuable insights into challenges and rewards of working in a different healthcare system. If you're a doctor looking to explore new career paths or considering moving to the UK, do reach out to us. And if you're ready to impact healthcare differently, join us at Disruptive Doctors. Follow us on social media, subscribe to our podcast, and don't forget to leave a review. Your feedback helps bring more stories of doctors who are impacting healthcare differently and changing the game. So stay tuned for our next episode, where we'll continue to explore how doctors like you are making a difference beyond the white coat. Until then, I'm Dr. Selina. Take care and keep disrupting the norm.
Join Disruptive Doctors. Oh, Disruptive Doctors. Impact